dental office is indeed classified as a healthcare facility. According to the National Electrical Code, a healthcare facility encompasses any building or portion thereof where individuals receive health or medical services. This includes diagnostic, preventive, therapeutic, rehabilitative, or palliative care. Consequently, a dental office falls under this definition and is obligated to adhere to the wiring methods prescribed for patient care areas as outlined in the NEC. These specialized wiring methods are crucial for mitigating the risks of electrical shock and fire hazards, while also ensuring the reliable operation of sensitive medical equipment. There are several specific wiring methods mandated for patient care areas. Firstly, the use of grounded receptacles is essential. Grounded receptacles provide a safe path for electrical current in the event of a fault, helping to prevent electrical shock. Secondly, ground fault circuit interrupters, or GFCIs, are required. GFCIs are designed to detect even small imbalances in electrical current, which could indicate a ground fault. When a ground fault is detected, the GFCI quickly interrupts the circuit, preventing electrical shock. Thirdly, isolation of electrical circuits is another important requirement. This involves separating electrical circuits that serve patient care areas from other circuits in the building. This isolation helps to prevent electrical interference and ensures the reliability of medical equipment. Fourthly, the use of shielded or isolated transformers for medical equipment is necessary. These transformers help to isolate medical equipment from the main electrical supply, reducing the risk of electrical noise and interference. Lastly, proper bonding and grounding of equipment and fixtures is crucial. Bonding involves connecting all metal parts of the electrical system together to create a common ground. Grounding involves connecting the electrical system to the earth, providing a path for electrical current to flow in the event of a fault. By diligently implementing these wiring methods, dental offices can proactively establish a secure and functional environment for both patients and staff. Grounded receptacles, sometimes referred to as three-prong receptacles, offer a vital safety feature. The grounding prong provides a low-resistance path back to the electrical panel, allowing fault current to flow safely and trip a circuit breaker, thus minimizing the risk of electrical shock. The NEC mandates the use of grounded receptacles in patient care areas to ensure this crucial safety measure is in place. Ground fault circuit interrupters, or GFCIs, are designed to protect individuals from electrical shock by monitoring the balance of current flowing in a circuit. If the GFCI detects an imbalance, indicating the current is leaking to ground, it quickly trips the circuit, cutting off the power and preventing a potentially lethal shock. GFCIs are particularly important in areas where water is present, such as dental operatories, as water can increase the risk of electrical shock. The NEC requires GFCIs to be installed in specific locations within patient care areas to provide this added layer of protection. Electrical circuit isolation involves separating the electrical circuits that supply patient care areas from other circuits in the building. This isolation can be achieved through the use of dedicated transformers or separate electrical panels. The purpose of circuit isolation is to prevent electrical noise and interference from other equipment in the building from affecting the sensitive medical equipment used in patient care areas. This ensures the accurate and reliable operation of critical medical devices. Shielded or isolated transformers play a crucial role in protecting medical equipment from electrical noise and interference. These transformers provide a barrier between the main electrical supply and the medical equipment, preventing unwanted electrical signals from reaching the equipment. This is particularly important for sensitive medical devices that could be affected by even small amounts of electrical noise. Proper bonding and grounding are fundamental to electrical safety in any healthcare facility. Bonding involves connecting all metal parts of the electrical system together to create a common ground. This ensures that all metal surfaces are at the same electrical potential, reducing the risk of electrical shock. Grounding involves connecting the electrical system to the earth, providing a path for fault current to flow back to the source. This allows circuit breakers to trip quickly in the event of a fault, preventing electrical hazards. The NEC provides detailed requirements for bonding and grounding in healthcare facilities to ensure the safety of patients and staff. Adhering to these wiring methods is not merely a matter of compliance, but a commitment to ensuring the well-being of everyone within the dental office environment. Electrical safety should be a top priority in any healthcare facility, and following the NEC guidelines for patient care areas is essential for creating a safe and functional environment. Beyond the specific wiring methods, there are other important electrical safety considerations for dental offices. Regular inspections of the electrical system should be conducted to identify any potential hazards. Electrical equipment should be properly maintained and repaired as needed. Staff should be trained on electrical safety procedures and how to respond to electrical emergencies. By taking these precautions, dental offices can minimize the risk of electrical accidents and create a safe environment for everyone. When considering the specifics of grounded receptacles, it's important to understand the role of the grounding conductor, typically a green or bare copper wire. This conductor provides a low impedance path for fault current to return to the source, allowing the overcurrent protection device, such as a circuit breaker, to quickly interrupt the circuit. Without a properly functioning grounding system, fault current could flow through unintended paths, such as a person's body, resulting in electrical shock. GFCIs work by constantly monitoring the current flowing through the hot and neutral conductors of a circuit. If there is any difference between the current flowing in these two conductors, it indicates that some of the current is leaking to ground. This leakage current could be caused by a faulty appliance, damaged wiring, or a person coming into contact with a live electrical part. When the GFCI detects a leakage current of 5 mA or more, it trips the circuit within a fraction of a second, preventing a potentially fatal electrical shock. Circuit isolation can be achieved using various methods, including isolation transformers, dedicated branch circuits, and physical separation of wiring. Isolation transformers provide a high degree of electrical isolation between the primary and secondary windings, preventing electrical noise and transients from propagating from one circuit to another. Dedicated branch circuits ensure that critical medical equipment is not sharing a circuit with other equipment that could introduce electrical noise or cause voltage fluctuations. Physical separation of wiring involves keeping the wiring for patient care areas separate from other wiring in the building, reducing the potential for interference. Shielded transformers are designed to minimize the amount of electromagnetic interference, or ME, that can radiate from the transformer. This is achieved by enclosing the transformer core and windings in a grounded metal shield. Isolated transformers provide a high degree of electrical isolation between the primary and secondary windings, preventing electrical noise and transients from propagating from one circuit to another. Both shielded and isolated transformers are commonly used in healthcare facilities to protect sensitive medical equipment from electrical interference. Proper bonding and grounding are essential for creating an equipotential environment, meaning that all metal surfaces in a patient care area are at the same electrical potential. This minimizes the risk of electrical shock by preventing a potential difference from developing between different metal surfaces. The NEC specifies detailed requirements for bonding and grounding in healthcare facilities, including the size and type of grounding conductors, the methods of bonding metal surfaces, and the testing procedures to verify the effectiveness of the grounding system. In addition to the NEC requirements, dental offices should also consult with a qualified electrical engineer or contractor to ensure that their electrical system is properly designed and installed to meet the specific needs of their practice. A qualified professional can assess the electrical load requirements of the office, select the appropriate wiring methods and equipment, and ensure that the system complies with all applicable codes and standards. Furthermore, regular maintenance and testing of the electrical system are crucial for ensuring its continued safety and reliability. This includes inspecting wiring and connections for damage, testing GFCIs to verify their proper function, and measuring the impedance of the grounding system to ensure that it is within acceptable limits. By taking a proactive approach to electrical safety, dental offices can protect their patients, staff, and property from the hazards of electricity. The National Fire Protection Association, or NFPA, publishes NFPA 70, the National Electrical Code, which is the widely adopted standard for safe electrical installations. Chapter 5.17 of the NEC specifically addresses healthcare facilities and provides detailed requirements for electrical systems in these occupancies. These requirements are designed to minimize the risk of electrical shock, fire, and other electrical hazards in areas where patients are receiving medical care. It is essential for dental offices to be familiar with and comply with the requirements of NEC Chapter 5.17 to ensure the safety of their patients and staff. Some specific NEC requirements for patient care areas include the use of isolated power systems in critical care areas, the installation of ground fault protection for personnel in wet locations, and the use of tamper-resistant receptacles in pediatric locations. Isolated power systems are designed to prevent electrical shock by isolating the patient from ground. Ground fault protection for personnel provides additional protection against electrical shock in areas where water is present. Tamper-resistant receptacles prevent children from inserting objects into the receptacle, reducing the risk of electrical shock. In addition to the NEC requirements, there may also be state and local electrical codes that apply to dental offices. It is important to consult with the local authorities to determine the specific electrical code requirements in your area. Compliance with all applicable electrical codes is essential for ensuring the safety of your dental office. Regular electrical inspections can help to identify potential hazards and ensure that the electrical system is in compliance with all applicable codes. These inspections should be conducted by a qualified electrical inspector who is familiar with the requirements for healthcare facilities. Any deficiencies identified during the inspection should be corrected promptly to prevent electrical hazards. Electrical safety training for staff is also an important component of a comprehensive electrical safety program. Staff should be trained on the proper use of electrical equipment, the recognition of electrical hazards, and the procedures to follow in the event of an electrical emergency. This training can help to prevent electrical accidents and ensure that staff are prepared to respond appropriately in the event of an electrical incident. A well-designed and maintained electrical system is essential for the safe and efficient operation of a dental office. By following the NEC requirements, complying with all applicable electrical codes, and implementing a comprehensive electrical safety program, dental offices can minimize the risk of electrical hazards and create a safe environment for their patients and staff. Remember that electrical work should always be performed by a qualified and licensed electrician. Never attempt to perform electrical work yourself unless you are properly trained and qualified. Electrical work can be dangerous, and improper installation or repair can lead to electrical shock, fire, and other hazards. The use of arc fault circuit interrupters, or GFCIs, is another important safety measure to consider in dental offices. GFCIs are designed to detect arc faults, which are dangerous electrical conditions that can lead to fires. Arc faults can occur due to damaged wiring, loose connections, or faulty appliances. When an GFCI detects an arc fault, it quickly trips the circuit, preventing a fire from starting. The NEC requires GFCIs to be installed in certain locations in homes, and while not specifically mandated for all areas of a dental office, their use is highly recommended, especially in areas where there is a high risk of fire, such as storage rooms or break rooms. Surge protection is another important consideration for dental offices. Electrical surges can damage sensitive electronic equipment, such as computers, dental equipment, and phone systems. Surge protection devices, or SPDs, are designed to protect electronic equipment from damage caused by electrical surges. SPD should be installed at the main electrical panel and at individual outlets to provide comprehensive surge protection. Uninterruptible power supplies, or UPSs, can provide backup power to critical equipment in the event of a power outage. UPS can be used to power computers, dental equipment, and other essential devices, allowing the dental office to continue operating during a power outage. UPS are particularly important in areas where a power outage could have serious consequences, such as in surgical suites or patient care areas. Regular maintenance of electrical equipment is essential for preventing electrical hazards. Electrical equipment should be inspected regularly for damage, wear, and tear. Damaged or worn equipment should be repaired or replaced promptly. Electrical cords should be checked for fraying or cracking, and damaged cords should be replaced immediately. Extension cords should be used only temporarily and should not be overloaded. By following these simple maintenance procedures, dental offices can prevent many electrical hazards. In the realm of electrical safety, portable generators must also be addressed. Portable generators can be a valuable source of backup power during a power outage, but they must be used safely to prevent electrical hazards. Portable generators should always be used outdoors in a well-ventilated area to prevent carbon monoxide poisoning. They should never be connected directly to the electrical system of the building, as this can create a backfeed that could energize power lines and endanger utility workers. Instead, portable generators should be connected to appliances using heavy-duty extension cords. Grounding and bonding requirements, outlined in NEC Article 250.16, are critical for safeguarding against electrical shock. Proper grounding ensures a lower impedance path for fault current, facilitating the operation of overcurrent protection devices like circuit breakers. Bonding, on the other hand, creates an equipotential plane, minimizing voltage differences between conductive surfaces and reducing the risk of shock. The NEC provides detailed specifications for grounding electrode systems, grounding conductor sizing, and bonding methods to ensure effective electrical safety. Overcurrent protection, such as circuit breakers and fuses, are essential components of an electrical system designed to protect against overloads and short circuits. These devices interrupt the flow of current when it exceeds a predetermined level, preventing damage to equipment and reducing the risk of fire. Circuit breakers are resettable and can be used multiple times, while fuses are one-time use devices that must be replaced after they blow. The NEC outlines specific requirements for overcurrent protection, including the selection of appropriate breaker or fuse sizes based on the ampacity of the conductors they protect. Wiring methods and materials are covered extensively in NEC Chapter 3. This chapter specifies the types of wiring methods permitted for various applications, including the types of cables, conduits, and raceways that can be used. The NEC also addresses the proper installation of wiring, including requirements for supporting, securing, and protecting conductors. Selecting the appropriate wiring method for a particular application is crucial for ensuring the safety and reliability of the electrical system. The National Electrical Manufacturers Association, or NEMA, developed standards for electrical equipment, including enclosures, wiring devices, and control equipment. NEMA standards provide performance criteria and testing procedures to ensure that electrical equipment meets safety and performance requirements. Compliance with NEMA standards is often required by electrical codes and regulations. Qualified testing laboratories, such as Underwriters Laboratories, or ALL and Intertech, test electrical equipment to ensure that it meets safety standards. UL and Intertech listing marks indicate that a product has been tested and certified to meet applicable safety requirements. Using UL-listed or Intertech-listed equipment is a good way to ensure that the electrical equipment in your dental office is safe and reliable. Regular maintenance and testing of the electrical system can help to identify potential problems before they become serious hazards. Electrical panels should be inspected regularly for corrosion, loose connections, and damaged components. Circuit breakers should be tested periodically to ensure that they are operating properly. Grounding systems should be tested to verify their effectiveness. Regular maintenance and testing can help to extend the life of the electrical system and prevent costly repairs.